Alright, so this lecture we're going to talk about Introduction to Renal Ultrasound and how it pertains to the critical care setting and emergency medicine setting. So just a information sheet, there's a tip sheet that's also located in this module that kind of goes through the renal ultrasound that we do here at University of Florida and what kind of things that you should be looking for. Now remember, it is one of the competency requirements of the American College of Chest Physicians. You can see here assessment of the urinary tract. So most of this lecture will go through some of the things that they kind of stated that we should have knowledge base of, and it's kind of just a general for that. So just like any of the other point of care ultrasounds we do, there are focused questions that you should be asking yourself. The first is to determine presence of hydronephrosis and or evaluation for oligoanuria. And then by the end of the lecture, I'm going to give you a few scenarios where they are starting to look into critical care literature for a lot of other disease processes such as heart failure and sepsis. So the focus questions you should ask yourself is there hydronephrosis and is the bladder distended? We will have more ultrasound research as increases in specific uses in critical care, as I mentioned earlier. And also as a procedural guidance for suprapubic taps, although we don't do this frequently, it's always an option. So just a slide about the anatomy. You remember there's a renal cortex, a medulla, pyramids. The normal size of the kidney is 9 to 12 centimeters in length, 4 to 7 centimeters in width. One of the important things is the location. On the left is a little bit more superior and posterior than the right upper quadrant due to the smaller spleen and air from the stomach. This is just showing you the probe marker should always be placed towards the head of the bed. And if you're on the right side of the chest, then you're probably going to be a little bit lower and more anterior. The probe you should be using is the abdomen probe. It has lower megahertz, lower frequency, and so you can have an increased depth. You can do longitudinal and transverse views. And remember, you should be scanning through the entire kidney. Here's a slide just showing the normal findings of the kidney. You can see the labels. This was kind of reviewed a little bit in the FAST exam, where you look for fluid between the kidney and the liver spaces. And you can see here where the cortex and the pelvis is. The renal pelvis is one of the most important for you to be able to find for the hydronephrosis. The bladder, you can see volume estimate, ellipsoid or cylinder. This is not often done in the ED or ICU, and now we have specialized machines that can kind of estimate. You can use it for clinical purposes for like post-void residual or detection of fluid. It's shown to be close enough. You can also use for detection of ureteral jets. Doppler of the bladder, you can see bilateral in patients with normal hydration. It goes against an obstructive uropathy. Here's a bladder, and then you can see a Foley catheter here, and this is actually a jet that's coming out. If you put the Doppler on, you can see if you see two of them coming out, then you can say that there's no obstructing stone. Hydronephrosis is actually graded in 4 different grades. Grade 1 is just slight blunting of the calyxes. Grade 2 is enlargement of the calyceal fornices, but easily visible shadows of papillae. You can see that here. This is the mild. Moderate is grade 3, rounding of the calyx, but no papillae still. And then grade 4 is extreme ballooning of the calyx. And we'll show you some images of that. So this is normal. You can see there's no hydronephrosis. This is a patient with dilated hydronephrosis. Sometimes pregnant patients normally have that. Here's a renal stone. You can actually see. You can actually see right here a stone with a shadow. Here's a renal cyst. You can see the renal cysts show up as nice circular echogenic anechoic collections. Here's multiple renal cysts. You can differentiate this from hydronephrosis in that the location is different. Usually the cysts are more peripheral. So a few things about scanning tips. If you're trying to determine between pyramids and hydronephrosis, the pyramids will be just below the cortex, and the hydronephrosis should connect dilated renal pelvis. Renal cyst versus hydronephrosis, the cysts usually are located at the cortex in the periphery. You can get false positives in pregnancy and prostatic hypertrophy, and you can get false negatives in patients who are severely dehydrated, so you should repeat after hydration. So on the horizon, I know most of this was just very simple evaluation of the kidney, but I think in the near future, we're going to be doing a lot more kidney ultrasound in the ICU. You can do it in the transplanted kidney as a post-biopsy. You can do it intraoperative. You can do it for vascular compromise, and you can do it for allograft dysfunction just by looking at flow. Like we mentioned, you can also do it for acute urinary obstruction, pyelonephritis, renal vein artery thrombosis, renal trauma, and sepsis. But most importantly for me, I see that there's a lot of evaluation using Doppler of the kidneys. So you can see here renal Doppler ultrasound, a new tool to assess renal perfusion in critical illness. And if you look over the last 3 or 4 years, there have been many articles coming out in different states in sepsis, heart failure, trying to determine what the kidneys do during those phases as the patient's on a pressor medication. And I think we're going to see a lot more articles on renal resistive index. And you can see the last article here talks about current and potential renal applications of contrast enhanced ultrasound. So I think there's a lot more contrast coming out for renal ultrasound. And I think that's going to help us out determining optimal perfusion status. That's it.